What is the most common cause of acute glomerulonephritis? Streptococci. Sunken eyes, loss of subcutaneous fat, muscles wasting, and 40% less body weight than normal are symptoms of which disease? Marasmus. Which of the following infectious disease is also known as German measles? Rubella. What is the surgery for cleft palate called? Palatoplasts. Treatment of diarrhea include ORS. Which of the following is not a symptom of kernicterus? Dark colored urine and stool. Due to congenital hypothyroidism, क्रिटिनिज्म होता है. Which disorder arises due to excessive secretion of growth hormone in adults? Acromegaly. Ascough bodies are found in which disease? Rheumatic carditis. The most serious complication of lead poisoning is neurological defect. The posture of a newborn at the time of birth is flexed. Which method is used to find out the progress in a patient suffering from disturbed consciousness? Glasgow Coma Scale. What should the diet of a child with acute renal failure? High carbohydrate or low protein. Which of the following is an infection of the lower respiratory tract? Bronchiolitis. Which of the following is not a symptom of neonatal asphyxia? Neonatal asphyxia का symptom कौन सा नहीं है? Hypocapnia. Which of the following is not a symptom of hypothermia? हाइपोथर्मिया का सिम्टम कौन सा नहीं है? तो वो होगा इंक्रीज पेरिफेरल परफ्यूजन. What symptom characterizes polycythemia in a child? Flushed face. Which of the following symptom is not studied in Glasgow Coma Scale? Glasgow Coma में कौन सा सिम्टम नहीं पढ़ा जाता? तो वर्बल आई ब्रीदिंग मोटर होता है, ब्रीदिंग नहीं होगा. In which of the following chromosomal disorder an extra chromosome is not found? टर्नर सिंड्रोम में एक्स्ट्रा क्रोमोसोम नहीं पाया जाता है. What causes excessive secretion of glucocorticoid in children? इन सब में से किस में ज़्यादा एक्सेसिव सेक्रीशन होगा ग्लूकोकॉर्टिकॉइड का बच्चों में? कुसिंग सिंड्रोम. What is it called when a child urinate on clothes or bed even after the age of 5 years? Enuresis. Hirschsprung's disease is most commonly associated with Down syndrome. Which of the following is a development disorder found in children? Autism. Which of the following is not a disease caused by deficiency of nutrient? न्यूट्रिएंट के डेफिशिएंसी से कौन सा डिजीज नहीं होता है? ओबेसिटी. What is the main cause of death in insulin dependent diabetes? इंसुलिन डिपेंडेंट डायबिटीज का मेन कारण क्या है डेथ का? तो वो है हाइपोग्लाइसेमिया, बहुत ज़्यादा शुगर लेवल कम. Which medicine will be used to correct metabolic acidosis in newborn? Metabolic acidosis बच्चों में करेक्ट करने के लिए कौन सा मेडिसिन देंगे? तो वो होगा सोडियम बाइकार्बोनेट देंगे। एसिडोसिस को न्यूट्रल करने के लिए हम लोग अल्कली दे रहे हैं सोडियम बाइकार्बोनेट। Which of the following test is done to find out whether the child has immunity against diphtheria or not? तो वो है सिक टेस्ट। Which of the following is not a genetic disease? इन सब में से कौन सा जेनेटिक डिजीज नहीं है? विम्स ट्यूमर, ये किडनी का डिजीज है, किडनी कैंसर, तो ये जेनेटिक्स तो नहीं होता। What type of vaccine is Salk type polio vaccine? तो वो किल्ड वैक्सीन होगा। What type of vaccine is hepatitis V vaccine? इन सब में से कौन सा हेपेटाइटिस वी का वैक्सीन है? टॉक्सॉइड ट्यूमर, टॉक्सॉइड होगा। हेपेटाइटिस वी किस में आएगा? ये किल्ड वैक्सीन है, सॉरी। Which of the following is not a symptom of dehydration? डिहाइड्रेशन का सिम्टम कौन सा नहीं है? तो प्रेजेंस ऑफ टीयर। Which of the following is not a major criteria for diagnosing rheumatic fever? कोरिया। The treatment method of phimosis is the treatment method of phimosis is making an incision in the foreskin of the glans penis. Repeated pulling of hair on the head by a child is called trichotillomania. Accumulation of thick pus in the pleural cavity is called emphysema. The most common type of cerebral palsy is spastic cerebral palsy. In which of the following disease there is destruction of bronchial and peribranchial tissue? Bronchiectasis. What is the most appropriate method of assessing the condition of a newborn baby? Apgar scoring. What does TABC use in resuscitation means? TABC resuscitation में उसका मतलब होता है टेम्परेचर, एयरवे, ब्रीदिंग एंड सर्कुलेशन। Which of the following symptom is found in anorectal malformation? Anorectal malformation में कौन सा सिम्टम होता है? Abdominal distension, meconium in urine, vomiting, all of the above. Which of the following is the most important cause of death among newborn baby? Septicemia. Which primary tooth emerges first in child? सबसे पहले कौन सा प्राइमरी tooth emerge होता है? Lower central incisor. Mump is a disease caused by which germ? मम्प किस जर्म्स के कारण होता है? तो वो होगा माइकोवायरस मम्प। The method used for temperature management in radiant warmer is servo mode. A congenital disease in which the distal end of the esophagus is closed is called esophageal atresia. Antisocial behavior in which a child deliberately engage in illegal activity is juvenile delinquency. Which of the following mental change is not seen in a child suffering from quasi or orchid? Irritability, apathy, hypersensitivity और lethargic. इन सब में से कौन सा नहीं देखने को मिलेगा जो बच्चा क्वासी ऑर्कर से सफ़र कर रहा हो? हाइपर एक्टिव. The milk produced in first few days during lactation is called colostrum. When more than one immunizing agent are given together in vaccine, then this type of vaccine is called combined vaccine. Which of the following vaccine is given at 9 month of age? इन सब में से कौन सा वैक्सीन 9 month of age में दिया जाता है? Measles. What is the end product of heme catabolism? Bilirubin. Red currant jelly stool is found in interceptions. Thank you for watching my video. Please guys like, share and subscribe my YouTube channel for more MCQ videos.